A little bit about breath before you swipe and say, no, I've heard all there is. I feel like breath's been popular the last couple of years or so, but it's getting really kind of diluted. And that's one of the first things that I have conversations with moms about, either when they come in during pregnancy or they come in early postpartum. I'm like, all right, tell me what you know, because that'll help me sort of figure out kind of where your understanding is, where there's any gaps, that sort of thing. And so when we talk about breath in pregnancy, the concepts are kind of the same, but we have to put them in different sort of kind of buckets, so to speak. So the biggest error that I see when people talk about breath, and I'm like, oh, what'd you learn about breath? They're like, oh, I learned about diaphragmatic breathing and 360 breath. I'm like, okay, well, when do you use it? And then usually I get a blank stare. And typically when I ask that and people don't understand, that I think is the biggest mistake that I see when we have this big, broad conversation about breath, is that people don't understand why they're using it. Yes, they know that we breathe, they know it's important, but they don't know why and what's the context. And I think those of us that have done ultrasound imaging, I've probably used it 12, 13, 14, 15 years now. We have a much better understanding because we'll use breath as a tool to get a certain response from particular muscles. So I'll talk about two specific types of breath. One is an activation breath and one is a relaxation breath. And relaxation is a little bit of a misnomer, but we'll get there in a second. An activation breath would be that blow, and there's a whole side conversation with that. With an exhalation, we should get some deep abdominal activation or transverse abdominal. But in a lot of cases, when people do the blow, they either do too much and we get internal oblique and not transverse abdominal, or they blow too little and we get nothing. But this is also the same breath strategy, that it's almost identical to open glottis breathing or open glottis pushing. So that vocalization, or ah, ooh, oh, where we're getting some deep transverse abdominal activation, giving a little bit of support, compression, whatever you want to call it, from above during a contraction, and letting the pelvic floor relax and get the heck out of the way. And a lot of people don't realize that those two are the exact same thing. So learning that in pregnancy is super important. One, to help with delivery, but two, because the belly's changing. I joke that it's changing zip codes every day, which is kind of the truth. The length tension relationship is changing by the day. Refining that is so important. And then same thing in postpartum, it's that rewiring, it's getting that reconnection again. Relaxation breath is when we get that pelvic floor to elongate. Technically, it's an elongation contraction, but for all intents and purposes, we're getting it to let go and relax a little bit more. But there's a purpose. We want to use the activation breath at a certain point in an activity, prior to an activity, mimic the automaticity of the transverse abdominal. We want it to anticipate movement, and relaxation, we want it to let go. So what's not captured in 360 breath, what's not captured in diaphragmatic breathing, is the context in which certain types of breath is really helpful in kind of eliciting certain muscle strategies. When I do see people focus on blow, I think the thing that people don't realize is not everybody does that the same. Asking somebody to blow through a drinking straw, or pretend like you're blowing out a birthday candle, or pretend like you're blowing a dandelion, does not elicit the same muscle activation strategy for everyone across the board. And that's where the benefit of doing a quick check with real-time ultrasound imaging is incredibly important. So we're going to post a little bit more about that this week, because I feel like that's coming up more frequently. But if you have questions about either activation breath strategy, relaxation breath strategy, 360 breath, diaphragmatic, whatever, post in the comments. I'm happy to answer. I feel like we're at the point in the breath conversation that we should have had this kind of figured out by now, or it should be really kind of common knowledge. But then also, if you are teaching this activation breath strategy, if you're doing that, you need to be able to recognize when you're not sure that that's actually what's happening, and then refer out to get some more confirmation, especially if somebody's symptoms aren't getting better. So anyway, post to me your strategies, kind of what people have taught you, what's your experience been with breath.